Yes, sir. We are good to go.
Okay. So good evening, everyone. On the eve of World Cancer Day, we have been joined by Dr. Waseem Abbas, who is a senior consultant medical oncologist affiliated with Max Super Speciality Hospital, Shalimar Bagh. Dr. Waseem Abbas has having a more than 2 decades of rich experience in medicine and medical oncology, as well as he's a clinical lead in medical oncology at Max Cancer Center, Shalimar Bagh, Delhi. He's a primary investigator of many national and international research projects and clinical trials and touched lives of more than 18,000 families during his tenure. Sir has a plethora of qualifications: MBBS from KSMA, DNB Medical Oncology from BL Kapoor Memorial Hospital, New Delhi, and Research Fellow in Medical Oncology from Batra Hospital and Medical Research Center, New Delhi. Sir has various awards also in his name: Gold Medal in MBBS 2002, Best Abstract at Best of ASCO 2014, and Sir has been member to various boards like ESCO, ESMO, as well as American Society of Gynecology Oncology, Society of Immunotherapy of Cancer, American Association of Cancer Research, American Hepatopancreatobiliary Association, American Psychological Oncology Society, International Society of Hematology, Children's Oncology Group, and American Society of Preventive Oncology. So it's a Guruve Nama. We will be learning a lot of things from Sir in today's evening session on this World Cancer Day. Sir, over to you, sir.
Yeah, thank you. Thank you, Neeraj, for your kind introduction. So good evening, everybody. And today, as we know, it's the 4th February. Today is the World Cancer Day. And why, like, we don't celebrate it, but we kind of cherish it that we are a part of this World Cancer Day. And we keep interacting this day to be with different people, because we know cancer is an aggressive disease, and as responsible physicians in the community, we want to make aware every member of this society why it is important to see cancer in a different way, why it is important to diagnose cancer early, and why it is important to treat it in a proper way. So I will come to that, but before that, I will tell you what is the theme. And as we know, this World Cancer Day, the theme for this year is closing the care gap. Because as we know, there is a lot of difference in care as far as West and as far as Third World is concerned. As we know, cancer is one of the world's leading causes of death, and this burden is definitely growing. If we see the data what we have in 2021, the world crossed a sobering, I would say, new threshold, and we have around 20 million people and were diagnosed with cancer, and 10 million died. And you can imagine 10 million died of this dreadful disease. That's the reason we celebrate this today as an awareness day. And as we know that these 20 and 10 million, these numbers are going to rise in decades ahead. And yet we know all cancers can be treated, but what the main important thing what we see is they can be prevented. Actually, many cancers can be prevented, and they can be cured. And for that cure, we definitely need a multidisciplinary boards, we need different facilities, and we need to empower people. We need to empower general physicians, and we need to empower our staff actually to work in shoulder to shoulder with us. So the theme, why is it, why it was the closing the gap theme for this World Cancer Day? And because we know care for cancer, however, like so many other diseases, reflects the inequalities and inequalities of our world. The clearest distinction is between high and low economics countries with comprehensive treatment reportedly available in more than 90% of high income countries. But what we have seen, if we see the low income countries, the comprehensive care which is available is less than 15%. And that we see is a huge gap. And that's what we have to close the care gap here. That's what we are looking at. We are looking at that we need to close this gap. And let me give you an example, childhood malignancies. If we see the the childhood cancer is one of the most common cancers, and it's the most very, when the survival of children when they are diagnosed is more than 80%. The 80% of pediatric population diagnosed with cancer are cured in high income countries, and less than 30% in lower and middle income countries. And again, see the gap, 80%, 30%. And I will give you other example of a breast cancer survival, like it exceeds now, really in West, it exceeds 80% in, I would say, high income countries, but the figure is around 65-70% in India. And if you go to African countries, it's about 40%. That's the theme. That's, again, we are discussing closing the care gap today. And recently, I think WHO has did a survey, and it was, I think, covered by government health financing scheme, and in an estimated of 37% of low and middle income countries. And definitely they saw that there's a huge gap actually. And the reasons are different. There are so many reasons for that. Why is this a gap, very big gap? So it's not only that the gap when patient is diagnosed with a cancer. This means that cancer diagnosis has the potential to push families into poverty, and particularly in lower income countries. And this effect, we know, has been exacerbated during the COVID-19 pandemic. And really, COVID-19 pandemic has taken its toll. It has really pushed some people in the poverty there, because their people are not earning that much money, and this, when somebody diagnosed, the treatment sometimes is very costly. So what I would be discussing what we have done, how India has succeeded in closing the care gap, how we have progressed how we have progressed during the last 2 decades. And we know much is being done to bring quality care cancer to countries, especially to India. And up till now, and we know we have been out of reach, and but a lot of things are happening, and it's not only happening in India, but WHO is focused. World Health Organizations are focused in cancer care, especially in most common cancers like breast cancer, cervical cancer. We know that can be eliminated. Childhood cancer can be eliminated as well. And the focus of each of these initiatives is low and middle income countries, where the biggest health gains are to be made. And we have made, really speaking, as far as cancer is concerned, we have made a lot of healthcare gains. And these integrated global cancer initiatives are being implemented by more than 200 partners around the world, including many development banks, which have significantly increased their investment actually. So investment is very important actually. Infrastructure is very important. And if we see, like, if we go back down the 2 decades in India, in our country, we saw that we had quite of a limited number of cancer centers in Delhi, and we couldn't find a cancer center in tier 2 and tier 3 cities. But now in last decades, we have seen that rising of these cancer centers in tier 2 and tier 3 cities. Not only the infrastructure which is being developed, I think government is spending a lot of money. Government is spending, doing a lot of work in uplifting the infrastructure, especially as far as cancer care is concerned. And if you go a far-flung area now, you go to even Silchar, you will find a world-class cancer center there now, which was not earlier there. So there are multiple schemes which government is bringing for the cancer care, and not only the governments, but corporate houses also doing their job in providing the prevention, diagnosis, multidisciplinary treatment, and supportive care to the cancer patients. So it is very important to navigate these services, and all this leads to a greater concentration of expertise and obviously better health outcomes. That's what we are looking at, because cancer centers don't serve as only for treatment purposes, but as well as training and research hubs as well. And in this way, help build country capacity and expertise. And you see now, as an India whole country, we are growing. We have a lot of medical tourism. Even the patients from other countries come and get treatment in India. So that's what our growth has been. So main focus, what we have seen, as I said earlier, we need to diagnose these cancers early. So prevention is better than cure, as we know. So screening is really, we need to make facilitating decisions on screening. Actually, it's very important element of comprehensive cancer prevention and control. And these should be national guidelines. They should come national guidelines, because decisions on what to include in a cancer program requires a consideration of number of factors. Like it should be a decision making on such issues should be on a country level, or WHO has keeps making the guidelines, I think, every year. And one is that important, that gap, which really we have been able to close that gap. And so screening is very important. We should be, breast cancer screening is very important. Breast is an aggressive disease. Even there are so many screening protocols, different screening protocols. Somebody is high risk, somebody is low risk. So definitely, if somebody feels, one should go to the oncologist or go to the primary care physician and ask them about screening. We have a cervical screening like pap smears, and then there is a lung cancer screening, especially in smokers. There are proper guidelines how to get screened for lung cancer. And especially in high-risk patients where you again need help of tumor boards, multidisciplinary teams, and definitely that will decide how to screen these patients. And one more important thing, which is like, as we are talking about the access to radiation therapy, which was not earlier there, because it's more cost effective, efficient, and widely used cancer treatment. And but main challenging thing is it requires you need a large facility, you need a bunkers for that, and you need a machine for that. And if we see the worldwide, even in India, we know that radiotherapy is still inadequate, and especially in other, not only in India, but other lower income countries. People have to travel far to get radiation done. So these efforts are being done, made, and everybody is like into it, that there should be one radiation machine in every city also, not in every city, and then every sub-city probably. And what main thing is what we have to do during pandemic, it has been a challenge really for us. And so especially as far as critical care as well as care to the cancer patients. So what we have been doing, we have been doing far reach OPDs and different cancer programs, and it has, what we have seen, that cancer screening and treatment has been challenging, but by collaboration, commitment, and solidarity, I think hope can be provided in millions of people actually. And we have been doing that, and I think somehow we had been successful by doing online consultations, virtual consultations, online support groups. Support groups are very important. And so again, my message here is somebody diagnosed with cancer should not, everybody gets panic. It is such a name, is such a dangerous name, cancer, but should not panic. Once you panic, once the decision is not right, I think it's very important to show the to the physician, have second opinions. That's very important. And main important thing is to understand like what the patient is suffering from, what is the stage, what is the disease, what is the survival, and what is the best treatment for the particular stage of cancer of that particular organ.
Sir, what do you suggest as a dietary things for our team and for ourselves, that what we shall be having in dietaries so that, we shall be preventing maximum cancers?
Yeah, that's a very good question. So what should we do? What should we be doing? Like, there's no diet actually which can like prevent kind of cancer actually. And if you see the cancers, they are like, if you see we don't know what is the reason actually for so many cancers. If you see we see a gallbladder on the Ganga belt, the people who live on a Ganga belt. But when we go to south, you will not see you see hardly anybody suffering from this CA gallbladder. So I think from diet is not so important as much as exercise is very important. So this exercise is so important. I think somebody takes care of his diet, but they keep lying on bed whole day actually. One should be doing, I think, sports. So I remember when we were children, we used to do a lot of sports, but nowadays children don't do anything. They keep sitting in front of TV and watching TV. And I think healthy food, whatever is made, whatever is your staple food, that's okay. But again, you have to take a lot of veggies and I think red meat avoided. And I think staple food. But overall, you should burn out these calories, whatever you ate. In the evening, you should think how many calories you have eaten, how much you have walked, how much exercise you have done, how much sports you have been doing. These things are very important, actually, rather than I would say diet. But healthy diet, yes, no junk food. That's very important. I think that everybody knows. Like, it has so many calories, it has so many bad fat which should be avoided. And I think rest is fine. Rest is okay.
So what is the duration of exercise in a week's time you suggest, sir?
That again is, you can't define it actually. See, it depends how much you have been walking. Suppose you work very hard and you walk 10,000 kilometers, 10,000 meters a day. So, or 8,000 meters. So that means you have walked during 7-8 kilometers a day during your work. I don't think you need to do more exercise, maybe for 10-15 minutes. And I would say if you are whole day sitting on your laptop and or watching TV, then you have to think, then you go out, and I think you should do exercise for a couple of hours, or at least 1 hour, or what they recommend minimum, if you are not doing anything, do exercise minimum for at least 10 minutes. That's the minimum requirement.
Okay, sir. And so, these are various viruses which cause long-term viruses, or chronic viruses, which we have heard that they are also get turned into the malignancies. So, what do you suggest a time duration person should wait for, getting a treatment from a doctor? Maybe 5 days, 7 days, 14 days, 21 days?
Like, can you repeat?
I'm saying, sir, a lot of viruses, if they are getting chronic, they are getting converted into the cancers.
Like, let me take you, like, you mean to say hepatitis B virus, right?
Yeah, yeah, yes.
Can result in which or HIV viruses actually.
True.
And I think again it's a multidisciplinary team, and there are screening protocols for that. Somebody having hepatitis B with chronic liver disease, we need to screen him accordingly. There are different screening protocols that to detect this HCC early and treat it early. And like we have HIV also we have different like screening protocols, and because HIV also can result in secondary malignancies. And I think one needs to be very watchful and keep showing and keep showing to his treating physicians. And I think his treating physicians should also be aware what to look at, how to screen these, or contact to have a multidisciplinary meeting in their hospital where they can discuss all these things, how to screen and how to keep follow-up of these patients.
True, sir. I think Neeraj has one question.
Yeah.
So, sir, thank you so much for the deliberation. My son is with me, so he
I can see that.
Hello, sir. So,
Hi.
So, sir, I have one question, sir, regarding the cause of cancer due to genetics, sir. Like I have a real interest in genetics, and I'm very curious that how genes have a role in cancer. Like, is environmental factors more, on the stronger side, or it is genes?
See, that's a very interesting question. Yeah, thanks for asking such a great question. So I would say we don't know a lot of things. If you ask me, we don't know what is the really cause of cancer. As I earlier said, Ganga belt, you see a lot of gallbladder cancer. Nobody knows what is the reason. Nobody can tell you what is the reason, really speaking. And CA breast, we don't know a lot of are sporadic actually. And genes, yes, genes have a very strong role to play, but the incidence is very less. It's kind of more than 1%. Where like cancer, you see the highest incidence of genetic cancers is in Ashkenazi Jews. If you are interested, you can read that. Nobody knows what is the reason, but yeah, if somebody in family is running a bad gene, and definitely then we should be very careful in their offsprings and in their children actually to look and screen them in a proper way. I will give an example of CA breast. And their gene mutation is BRCA1, BRCA2 on chromosome 17. So you must heard about Angelina Jolie, and she also had bad genes. And she was a BRCA1 positive and BRCA1 negative, where she got her both ovaries and breasts removed. That's called prophylactic oophorectomy and prophylactic mastectomy bilateral. And you must have seen the movie Tom Raider, I hope. Maybe not. So we have a 2 generations gap. So that is so bad genes are there, but a lot of cancers we don't know what is the reason. Really speaking, we know the reason of a lot of blood cancers. We don't know a reason of lung cancer actually in non-smokers. There are driver mutation, but nobody knows. Is it pollution? Can be pollution. Is it scar? Somebody having infection or TB in the past? Is it scar cancer? Maybe it is possible, and there are so many syndromes actually which can result in malignancy, where, as you said, it is genetic, but it's very less actually. We have to understand a lot. We don't know much about actually the causes.
So, sir, do we need a very detailed study regarding that? Like, what community in India is more prone to cancer, or?
Yeah, I think we know that. It's not that everybody knows actually. If we go, let us start from the map. Start from the Kashmir.
Kashmir.
Kashmir. There was a route earlier. It's called Slick Route. You know what Slick Route was? When they used to do trading through Afghanistan to Kazakhstan and Turkmenistan, and you can easily see that the most in Slick Route, the incidence of stomach cancer, GI malignancies is very high. And you move down to the Punjab, and you can see the incidence of CA breast is very high in there. I mean, do we know? We don't know the reasons actually. And move down there, you move to Delhi and see where the Ganga goes, and you can see a lot of CA gallbladders. And go to the south, and you can see the incidence of cervical cancer is very high. And what factors play a role, really do not know. I don't know. Or there are other smoking, and I think betel nut induced cancers, that's a different story actually. But yeah, it might depend on environmental factors, food, but nobody knows actually. But yeah, we are looking into that, and a lot of research is going on actually. But yeah, that was a very interesting question actually.
Thank you, sir. Thank you very much.
Sanjay is having one question. He would like to.
Yeah, great.
Sanjay, your voice is not coming.
I think he has to unmute himself.
Still, voice is not there. You can put your question in chat box, then we will read it out for sir.
Yeah, you can put on chat box. I think that will be great.
Yeah. So, sir, can you throw some light on?
I can hear.
Yeah. Good evening, sir. Sir, just one question regarding gynae oncology, sir, gynae cancer. So before screening, if the lady is not going for the screening, so what are the noticeable symptom for the lady? Like when she is working at home, she is not maybe in the professional or in any of the corporate.
Yeah, I understand. So how can she feel? See, it depends. All depends at what age actually. What is the age? And
around 40 years.
What is the family history? See, 40 years, you can see very difficult diagnose actually. At 40 years, we don't see much of a cancer. And the incidence of cancer usually high is more than 60, 55, 60 actually. And in 40, very difficult to diagnose actually cancer, unless until the patient is high risk, where we have screening protocols. It's simple. You can have a lump anywhere. You can have abdomen. You can have a bloating. You can have abnormal bleeding. You can have like menorrhagia, where you need to, it's a menorrhagia where you need to show your gynae, and where the examination she will do, and she might find anything incidentally actually. But yeah, like this, it's very difficult to diagnose actually. These are the symptoms probably. I think abdomen distension, bloating, irregular periods, menorrhagias, and I think probably postcoital bleeding. These are some most common causes actually.
Okay, sir.
And if you see like postmenopausal, the most common is like you have a bleeding per vagina. And if she is a postmenopausal, why should she have bleeding? That's the most common cause. Another most common, like not cause, symptom, sorry. Another most common symptom is a abdomen distension in young. Yeah,
sir.
You were asking something.
Yeah, sir. There is a lot of hue and cry about this mobile radiation, sir.
I don't have any clue. I tried to look out actually. I tried to read a lot about mobile radiation, and there were a lot of studies actually done which couldn't prove actually the role of mobile radiation in cancer actually. You mean 5G or 4G or 3G?
Sir, all these mobile towers which radiate a lot of rays.
But there is no data actually. See,
yeah.
I think one should avoid. We don't know anything about that, whether the people who live under it, the incidence of cancer is more there. I don't see. We don't have a proof actually. Like others, we have seen the people working in leather factories and tanning factories. You have a incidence of cancer is very high, especially bladder cancer. But mobile towers, a lot of studies were done. I don't think they gave such a conclusive report.
True, sir. True. Team, do we have more questions?
So I don't think we have any questions, and so I think we will conclude this session now.
True, sir. So thanks for all the deliberation, sir. The initial pitch you have given has given a lot of information. The whole paradigm you have shared, from non-pandemic to pandemic, as well as financial burden, as well as various guidelines which you have shared, sir.
You want to convey. I think Neeraj wants to convey some message, and Neeraj is saying anything today.
No, sir. I was just listening. I think there was a query in mind. सर हम लोग अर्ली डायग्नोसिस के बारे में काफी बात करते हैं. So आपके हिसाब से किस एज में आने के बाद हमें बहुत ज्यादा क्यूरियस होना चाहिए इस चीज को लेके कि कैंसर कैन डेवलप? मतलब
I think it's a challenge for a country like India actually. It's a huge country, and as I said, low income different challenges in life actually, and access to healthcare system. And I will give you example, like you see it, you have a data from AIMS and you see the data from West, and if you see the AIMS data, I think a lot of breast cancer patients used to present in stage 3 or stage 4 early. And if you go to West, a lot of cancers are screen detected, and we have clinically detected tumors. And but if you see now at AIMS, they say also stage is coming down actually. We see a lot of stage 2 patients. So that's what the need for awareness, socioeconomic status, and because see, in our India, we are like always occupied with other things. So in West, they're thinking of about their health is a different thing, because that's a primary issue. And I don't think over in our country, the health remains a primary issue actually. That's where we lack actually. And screening for different cancers, as I said, has to be, I think, guided by local physicians, local WHOs, and local bodies actually. And that's what we do. A lot of I think, awareness campaign. We keep it doing always. We have been doing it to make people aware, like why should they get screening, when they should get screening, like. And especially we make aware the primary physicians who work with us or who are in our community. We do lot. I think Dheeraj is there. He knows we do a lot of general awareness. That right, Dheeraj? I think Dheeraj has been doing a lot of awareness campaigns with us, right? That's what I was saying.
Yes, sir. Yes, sir. We are doing so.
So, and that's what different screening. Breast screening is different. Lung screening is different. Screening is different. Screening for high risk patients is different. Who have high risk genes, as your son was saying, or who have kind of multiple like family members diagnosed with cancer. And so I think Dheeraj, you want to say what's your take today on World Cancer Day?
I think yeah. So just one last question, that to be a message for smokers as well as non-smokers, how to prevent, sir. How to prevent lung cancer as well as head and neck cancer.
I think they should stop making cigarettes. I think that's the answer actually. I don't see any other answer actually. That's really a challenge.
Bang on. Yeah.
Huge challenge. Again, I would say awareness. And it's not that easy. It should be a very strong awareness to get involved. It takes a lot of courage. That takes a lot of, I think, work actually. It's not that easy.
True. I think one of the colleague, Usman Basha, you would like to ask one question, sir.
Sir, good evening, sir.
Yeah, hi, good evening.
Sir, I have one question, sir. Yeah. What is the age limit for papilloma virus vaccine, sir?
I think it keeps changing actually. The initial age, they say it should be, see, we offer it to everybody actually. They say it should be started at 9 years, and there are different vaccines. We have a pentavalent vaccine and we have a trivalent vaccine. So it should be started at age as like 12 years, which is the appropriate age. And it should be till like 18 years. This is the best age to give it. Later on, you can give it at any age after that. Nobody knows the benefit of that.
Okay. After 25 years, so there is no use.
Nobody knows actually. Somebody, see, it depends like how are you, somebody says if you are not sexually active till 55 or after that, you can give it actually.
Okay.
Might benefit actually. But yes, the data is not for that.
Yes, sir. Thank you, sir.
Any other questions, team?
Sir, one question, Sir Ashish, this side.
Yeah.
Sir, one question is there. Sir, do you find a difference in terms of the incidence in lung cancer in the cities and in the rural, like, so the city population and to the rural population? Is there any difference?
I don't know the data really. It's a very difficult question actually. You mean to say incidence you see in cities than rural areas, right?
Yes, sir.
Question. I don't think so actually. I have not seen that actually. I think equally, really speaking.
Okay.
I think the incidence is more in cities actually. And if we talk about general, see, we can talk about smokers, not Smokers. So you're talking about smokers and non-smokers. That's also
Yeah, sir. I'm talking about non-smokers, sir, actually.
non-smokers. I think the incidence is same. I don't think it's a different.
Yeah. So this query came because of the context of air pollution, sir. Like means my thought was that the pollution is more into the cities and maybe less into the village or rural.
Yeah, but we don't have such data. See, I cannot say like here, like it's a huge statement to make. But yes, it's a startup. We can see some like say the per se the malignancy is not because of pollution. It's because of the damage done to lungs by the pollution. You have more bronchitis, you have more infection, you have more scarring of this tissue of lung cancer. That might cause actually the rising incidence. But see, we need exactly academic data, scientific data is not there, so I can't say that.
Thank you, sir. Thank you.
I think, sir, we have taken a lot of your time because you just reached from hospital and we have you in this meeting.
Yeah, today is a very important day, I think, for you and for all of us.
True, sir. True.
Looking for forward for this year to be working with you in lot of for a lot of
awareness sessions.
Awareness, I think that's very important.
Definitely, sir. We will partner, sir. So thank you, sir. Thanks for sparing your time and in such a short span of time, giving a lot of information, which been gathered in long time. So thanks a lot for coming up for this event. And if some more questions will be there, we will be asking personally and communicating to our team, sir.
Thank you,
thank you, sir.
Thank you, sir. We are truly indebted, sir. Thank you, sir.
Thank you, sir. Thank you, and
Thank you, sir. Thank you.